Well, that was a wonderful start to the day. Thanks so much, Joe and Angela. As you know from your booklet agenda, we're going to be moving on to speak a bit about mindfulness, particularly mindful movement. So I just want to say first that I'm also someone who has lived experience of a child with a disability. And it is, we all have our own stories. My son, at age 15, started to have seizures and then was diagnosed with epilepsy. It took about a year for the diagnosis. He now lives independently and is doing quite well, seems to be under control for the moment, so that's a good story. But the reason I'm saying this is that I have some understanding of the way that experiencing these traumatic events can trigger trauma from other times in our lives. And that's anyway how I conceptualize it for myself. And also of what worked and what didn't work for me, like we were talking about earlier. And just how certain things can really make things more difficult, like lack of sleep, etc. So yeah, I just wanted to say that first. When we start this session, I think it's really important to remember, and for me to remember, and to tell you that I know that this is not a panacea. I don't believe that it is. I don't think that we need to be resilient, like I think Angela was talking, and Joe, that there's a myth that somehow, if all were more resilient, things would be fine. Me talking about this doesn't mean that I believe that. I became a psychologist and a psychotherapist before any of this happened with my child, and I was already practicing these things. And I've hopefully be able to convey it in a way that makes it possible for people to bring it into their lives. So I also want to say that I know that some of you already practice mindfulness or have heard of mindfulness and maybe have strong feelings about it. But I want to say that there's many ways of teaching mindfulness as there are mindfulness teachers. It's an ancient practice. And one thing that I invite of you today, and I know it's hard in a room full of people, many of who you don't know, is to just bring a naive stance to it. And what we mean by that is like a child's eyes to the session, as though you've never heard of it before, even if you have, which is what children are so good at, is just being in the moment. Okay. So I want to say also that I understand that a lot of us do store trauma in our bodies, and maybe from early in life, like myself, and that can be triggered. And that some of the practices today might not be your cup of tea. You might know that, for example, paying attention to your breath is not a good thing for you to do, especially in a room full of people. Doing is not the point of this session. It is about you becoming aware of, or becoming more aware of, or giving yourself an opportunity to become in touch with yourself. So if you know something about yourself, or that it doesn't sit well with you, or you're saying, why is Lisa telling me to do this? I don't want to do it. Just being aware of that is being mindful. And please take a moment to yourself, pause and say, okay, I'm going to sit this one out. And that is absolutely being mindful. Okay. So I'm going to start with just introducing a little bit about what mindful movement is. I mean, this is the kind of what we're going to look at. So just with a little bit of a demonstration for yourself, again, decide for yourself whether this is something that you want to do. But it's possible to pay attention to the breath. It's also possible to be attentive of sounds, for example, in the room. That is a trauma-aware way of being mindful. So I'm just going to invite you to do one of those things at the moment. It's either just paying attention to your own breath or pay attention to the sounds in the room. Now you can shut your eyes if you feel comfortable, you can lower your eyes if you don't, or do what you need to do, and just for a few seconds. Okay. All right then, we're just going to come back now and come back to the room in whatever way is least jarring for you. Right, so now as an introduction of mindful movement, I keep wanting to walk over here and I can't bring the mic with me, but I'm going to ask you to just put your hands over your abdomen, maybe have your fingers, and instead of attending to your breath, or whatever that means to you, just notice maybe wherever you feel in your body the breath is most prominent, notice it moving your fingers as you place your fingers over that area. So it's the movement of the breath, so we're always moving. And if anything comes in your way, into your mind while you're doing it, and you notice that that's come to your mind, then tell yourself, well done for noticing. Okay. All right. Great. So coming back to my voice when you're ready in your own time. So the reason that we've kind of brought this in is that asking someone to pay attention to their breath at a point where they're stressed, even if that's something that they've developed as a really, useful skill that works for them at the most times, it is not going to help, may not help, possibly or probably won't help them in that moment. Our breath becomes dysregulated as part of the nervous system, and, that's just human. So for having other things that are at a distance from the core of our body can really be special for us, a special technique for us at those times. Thank you everybody for taking that risk today. So I just wanted also to remind you that compassion for whatever happens is what this is about. It's not doing something, it's having compassion for ourselves, and we'll talk about that a little bit more in a few minutes. And the reason that we use the body is because of sensation can be a real help to us in being aware. So, and creating this sensation, which is different than the traditional mindfulness, which is staying with whatever arises, but creating a sensation by movement is a louder sensation than perhaps just noticing the breath or just noticing a feeling. So movement deepens the experience is the, in theory. It won't be true for everyone, so it's really up to you to decide for yourself. But well done for taking the risk today. Oh, I won't go there yet. So, I just wanted to say also that there is a little bit of research. I haven't put it up on the screen, but I will put the references in the pack that we'll send over the internet at the end of today. That where there's support for mindfulness, reducing parenting distress amongst parents of disabilities. So there, for example, there's a 2017 study that shows that mindfulness-based interventions can support children parents of children with disabilities, stress reduction interventions for children with on the autism spectrum, for example, in a 2023 literature review. So these are all like systemic literature reviews that take into account all the literature that's been done on this area. Just so if you're not aware, there's so much mindfulness research that there are literature reviews of the literature reviews. Not about parents, of course, parent carers, but it's a growing area because I've been able to find very recent research from this year. There's even a physical health condition systemic review for mindfulness-based intervention for children, adolescents, and their parents from 2023 that shows that there's promise for improving anxiety and depression in children with physical health conditions, but limited support for reducing stress in the family. So it's not a panacea. I really want to stress that. There is another couple of pieces of research I just want to quickly mention. One is that there has been a brief online mindfulness parenting program a study. It's a pilot, and it's from 2023, and it's looking at online mindfulness for parents. Now, what they found is that if parents study mindfulness online, there's low adherence to the program, meaning that they're less likely to do the kind of homework. And then less likely to have the kind of positive outcomes from practicing mindfulness. So this is something that I've been really interested in ever since I studied mindfulness, is how do we keep this up? I mean, you probably, if you've read anything about it, and I think most people probably have heard of it, it's like, you think, well, 10 or 15 minutes a day or something like that, or a few times a week, I'm not going to fit that into my schedule. And I have to say from personal experience that was true for me as well. When I first started doing it, I couldn't fit that in, I couldn't manage it. So that's partly why I wanted to speak about this today, because there are other ways, other than dedicating a kind of time every day, and we can fit it into our lives. So what we can be mindful of is the next thing I wanted to talk about. So sensations, bringing memories and emotions, thoughts and meaning. So now we're ready for this slide. Just kind of be aware of what this brings up in you. It could be a memory, it could be a body sensation, it could be emotion, thoughts. I know that Joe mentioned a roller coaster of parent caring earlier. It does replicate life to some degree. So, and just a question that maybe we'll go back to later if we have time is, can you ride a roller coaster mindfully as well? Okay. So this kind of activity, which I avoid at all costs, by the way, why do we get dysregulated? That's something that really interests me is, okay, yeah, people talk about mindfulness works, but I want to know why. So this is your body, all of our bodies. The nervous system that Dan Siegel talks about, you may have heard of him, he's worth looking up, is the memory is key to the nervous system, is what he talks about. So what to get from this quote that I put on this is that instinctive brain that we have. So it's not integrated necessarily with all of the parts of the brain. So the prefrontal cortex, the part of the brain that is involved in planning, for example, may not be integrated with our memories, might be down back here in the limbic system, which is involved in emotion, and is very close to our motor system. So that's why we kind of will run, flight, fight, before we think. It's just a split second, but it's enough. Okay. And this is also how movement via sensation via movement can come into play. Actually, I will go to the next slide, but I wanted you to be aware of, see that sort of spaghetti-like stuff? This is the vagus nerve system. And some of you may have heard of polyvagal theory and that kind of thing, or vagal tone. And it's very much a system that you can see. It goes all the way up to the brainstem and then all the way down into our organs, into our abdomen. And so what happens really is it goes in two directions. So the vagus nerve comes down the body and it asks all of our organs, are you okay? Are you okay? Are you okay? And then sends a message back up to the brain to say yes or no, and then sends the right, or what we need to do to our muscles. So let's say we, out of the corner of our eye, see something that we think is dangerous to us. We might jump, and then we might decide, oh, actually, I don't have to take, we can pause and not have to take the action to eradicate the danger. Or we might just swipe out and not pause. So that's where pause comes in. So I just wanted to bring this in, just to a little bit of an understanding. And there are some things that we can do to calm this vagus nerve system. So one thing is, in Chinese medicine, there is a system called, it's just called the central channel. It basically comes all the way down your front. So this is something we can do. You don't have to do it now. You can if you want. If you don't feel comfortable, that's fine. But I'm just demonstrating it. You can move the hand down from the heart space down towards the abdomen. And that has an effect of calming this vagus nerve system. Okay. So we'll go back into that a little bit later. So I really wanted to bring in this as well. I always talk about this, Balin and Hughes. They have a book called Brain-Based Parenting. I think everybody should read it, not just parents. Saying that is supposed to be for lay people. It is not. So if you buy it or look them up and you say, this is like, I can't understand it. Other people I've given it to who are professionals can't understand it. But there are some really good things to come out of it. One is the idea of safe approach system. So our brain tells us whether it's safe to approach another person or whether there's danger and that we need to take some safety. When we're with our children, we want to be in a safe approach system. We want to be able to relate to them. And it's true for professionals when they're with their clients or patients or anyone who's dealing with anybody, you and your local shopkeeper. So these are ways that we can stay in those safe spaces in ourselves. Playfulness, acceptance, easy to say, curiosity about what's going on there, rather than jumping in with a prejudged idea. And empathy, of course. Well, it all sounds easy. And I really wanted to bring in that noticing leads to whatever that we're trying to do. So noticing, meaning noticing when we're not being mindful. So when we're just doing that little exercise, I think I said something about if something comes into your head that takes you away from this, noticing that sensation, then that's fine. You pat yourself on the back, you've done it. Noticing leads to ability. Noticing that we're dysregulated leads to us being regulated. Noticing that we're afraid can lead to us calming ourselves or soothing ourselves. So, I wanted to show this because, just to show that in our environment. So what we can be mindful of, we can be mindful of our bodies, but also just something that I happen to have a tree outside my window. I'm lucky. But we don't all have trees outside our window, but maybe we can look at something that brings us a sense of awe. And awe has that, I'm saying AWE, by the way, it's my mid-Atlantic accent. Awe can, it brings physiological changes to us. So facial muscle movements, we have raised inner eyebrows, apparently, widened eyes, open and slightly dropped jaw. Isn't that what they tell you to do when you're to relax? And we may make vocalizations such as whoa. So, and it increases our vagal tone, reduces our any symptoms from our central nervous system, such as, sweating, feeling heart palpitations, that kind of thing. So there's some research on this, and I'll leave the reference for that as well. Okay, so what is this? A bit easier. At last. You may have realized, oh yes, this is a visual example of going from a wider or floodlight, we might call it, awareness, down to a spotlight. Oh yeah, I can't actually see my finger, but if I put on my glasses, I can. Oh yeah. So this is one of the things that we can practice for ourselves. It's going from a wider awareness to a narrow awareness, and actually can change our ability in lots of ways, and I'll talk about that in a minute, not only physically but also emotions, taking us from a wider external emotion into ourselves, into a more narrower self-related emotion. Awe takes us to a more external emotion, external awareness, and also can be more social. So, it's the flexibility, the ability to switch between these things that we're looking at here. But let's try a tactile example of this. So just taking your fingers and lightly touching them. And again, check in with yourself. You do not have to do this. Just gently touching, noticing that sensation. And then pressing a little bit more, noticing that sensation. And then maybe pressing even harder, pushing, and seeing what you notice there. So what I wanted to share about my experience of this is that the light touch, it's very sensitive. I can really sense that my palms have a lot of sensitivity. When I press a little bit harder, I can feel maybe the fascia, maybe the connective tissue in the hand is quite spongy. And when I press even harder, I can actually feel my skeleton through my hands. So these are just things that we have available to us at any point. Fortunately, we have our hands available to us that we can use to draw our attention internally. Okay. So we can also make our awareness larger. We can make large movements. Of course, we look just like that when we do it. We can focus on a quite simple movement that can really bring our attention to our bodies, and we'll talk more about how that helps us and what things that we can attend to when we're doing it. Like, for example, when I'm moving my arms, I can pay attention to my hands, or I can pay attention to this part of proximal, the bits of me that are closer to my center, my elbow, what are these called? Shoulder girdle. So I can move my attention from my hands to my shoulder girdle. What's the point of all this? And reminding of just being for a moment. It's not about doing, it's about how we attend to ourselves. And it's not that easy. This is the kind of definition. It's not really that easy, is it, to pay attention in the present, on purpose, without judgment, acceptance, oh my goodness, kindness, curiosity, openness, all great words, not that easy to do. So there's some complications with this. But it's something about reminding ourselves that it's not about doing it, it's about noticing how we are in the moment. And the more that we notice, right then I wasn't being mindful, I was unaware of myself in that moment. And that's the moment when we're mindful. So I just want to invite everybody to give themselves some kind of a hug. Now, one thing that we can do is we can rub our upper arms, which is for some people, if it feels right for you. And I want to remind you to pay attention to how that feels for you and to allow yourself to not do this if it doesn't feel right for you. Any sensation, any part of the body that we attend to with sensation, the rest of the body is aware of. Okay. Another thing that we can do, which comes from energy medicine, is that we can then slide our hands down and join our hands, palms together. So our palms are facing one another, if that's possible for you. And then bringing them in towards your chest. It doesn't matter how you get there. And noticing the feeling of the hand against the chest. Okay. And just allowing yourself to come out of this posture mindfully, planning how you're going to do it in your own time when you're ready. And there's something about the crossing as well that means that the two sides of the brains work together. So you may know this, people whose children have had some training may have been trained to do this kind of thing to help, and we can use that as well. Which allows the thinking part of the brain and the emotion center to work together. So, allowing sensations to rise and fall can really lead to an improvement in our emotional capabilities and our mental resilience. Okay. So we can be mindful in lots of areas, lots of things. Watching or playing something, we can focus on the game or the movie. We can then focus on our room around us. It's possible to stay mindful. Being with friends, we can stay mindful of ourselves and when we're with others. And other activities. What about being on a roller coaster? I think it's possible, not for me, but possible for some people to stay with themselves and be aware of the environment around them. So I just want to bring this slide in because just to say that, remind us that this is a innate human ability. It exists in so many different of our cultures and religions. Prayer is one of the ways that we can both bring awe and mindfulness to our lives, if you're a person of faith. In neuroscience, it can exist as memory, sensation, attention, awareness, intention. And this is the model that I wanted to get to, is how, so this was created by someone called Tamara Russell, and the three-loop model means that sensation, emotion, and thought all work together. So what she says is, and she's a neuropsych and a clinical psychologist, and her theory is that The mindfulness exists in those areas of, for example, sequencing. If we teach ourselves to walk, paying attention to the order of the walking, those who have done mindfulness before may have experienced mindful walking. We're also training the emotional and thinking part of the brain to sequence. If we are practicing attention, floodlight, spotlight, we're also, and we're doing that through shoulder rolls, for example. Oh, that shoulder feels a bit tight today. We're also bringing attention, learning attention, teaching ourselves attention in our thinking and feeling parts of our brain. So it's a little bit of a swap round to how people often teach mindfulness or think of it. But we'll do a little bit more in the session. But those of you who aren't coming to the session, Tamara Russell has a couple of really good books that I find really useful on this. And you're free to come and ask me as well at any point if it's not that clear. So things that we can train in the brain are memory, sensation, attention, awareness, intention, and sequencing. Those are some of the areas. And the motion, movement, and thinking are all innervated even, when any of these processes happen. Movement can change the structure of the brain to coordinate higher order functioning. Okay. And you've seen this in child development, that movement goes along sometimes with changes in perhaps other abilities like communication. It's also true through human history. So, I just wanted to finish by reminding of how training through the domains, through physical exercise, we can facilitate our cognitive and emotional functioning through these different ways, in these different ways. Having an intention rather than a goal. Ordering our movements helps to order our thoughts and speech. And paying attention, and I put emotional contagion and mind reading there, paying attention to the other helps us to read the other person. And this can benefit our relationships through developing empathy in ourselves and the other, and also calming the nervous system so that it's possible for us to be empathic in any moment. Of course, always a big call, but it's not. We all can lose our regulation at some point. We all do. It's not about not losing your regulation ever. It's about how quickly we can train ourselves to recover from that. Okay. So, maybe bringing your hands to your heart, if that feels okay for you. And if you take nothing else from today, which is fine, just remembering that learning inattention helps us to, leads us to the ability to pay attention. So just noticing, oh, I wasn't paying attention there. Well, that's mindful. Learning mindless movement helps to teach us what it is to be mindful in our movement. And learning unease, noticing unease, helps us to be aware of what it means to be at ease. And that's the compassion piece in this work, in this practice. Giving yourself a pat on the back. Give yourself a pat on the back for being here today. Fantastic. Well done. And thank you so much for listening to me. Please do come up and ask anything you want to.